Hi everyone, my name is Stacey Miles and my topic is fibromyalgia. Fibromyalgia is a complex chronic pain syndrome characterized by widespread musculoskeletal pain. It's actually the second most common musculoskeletal disorder, and that is after arthritis. Fibromyalgia is not considered as a disease due to the wide range of symptoms that make up the syndrome. So it is considered a syndrome. In order to be a disease, it has to have a cause, and as we'll find out later, fibromyalgia does not have a cause. Fibromyalgia is often accompanied by sleep, fatigue, memory, and mood issues and disorders. Who is affected by fibromyalgia? Interestingly enough, 80% of those diagnosed with fibromyalgia are women, and these patients typically do not be diagnosed by a physician until middle age, and that age is typically around age 30. That does not mean that symptoms can't be present in early ages, both in men, women, and children. So men, women, and children can be exhibiting these symptoms, but they might be overcasted by another disease or illness, which we'll find out about later. Individuals with rheumatic disease, such as rheumatoid arthritis, spinal arthritis, and lupus, are also more likely to develop fibromyalgia due to overlapping symptoms. As you can see in the diagram, currently there's over 12 million Americans that have fibromyalgia. And like I said before, the most common age range is 30 and older, and most common gender is women. Some of the symptoms include cognitive and memory disturbances, soft tissue tenderness, morning stiffness, headaches, irritable bowel syndrome, painful menstrual cycles in women, numbness and tingling in the extremities, restless leg syndrome, temperature sensitivity, sensitivity to light and noise, and sleep disturbances. This diagram shows some of the early symptoms and common misdiagnoses of fibromyalgia. So as you can see, starting at the head, there's depression and anxiety, sleep disorders, and migraines. Then there is jaw and facial tenderness. The tenderness goes along with the 18 tender points, which we will discuss later in regards to diagnosing fibromyalgia. And as you can see, there's numbness or tingling in the limbs, fatigue, irritable bowel syndrome, painful menstrual cycles in women, morning stiffness, and as you can see in the bottom left, it depends on the time of day. So these symptoms are very individual specific. There's not 10 symptoms that make up every single case of fibromyalgia. And if you can look in the bottom right, there's common misdiagnoses because fibromyalgia shares many of the same symptoms as other disorders such as chronic fatigue syndrome, lupus, depression, rheumatoid arthritis, and other infectious diseases. As you can see in this diagram, it is a more in-depth visual on symptoms. So starting at the head, there's chronic headaches, sleep disorders, unsteadiness, cognitive impairment. In the eyes, there's vision impairment, which can also go with dizziness and balance issues. In the skin, there can be tenderness, itchiness, dry skin. In the stomach, nausea, and lack of stomach acid is very common in individuals who have this. Joints, morning stiffness. It's a common misconception that there is inflammation throughout the whole body with fibromyalgia, and it's more of a generalized pain and a widespread pain throughout the entire body. The epidemiology, like I said before, 12 million people in the United States have this syndrome, and this affects 3 to 6% of the total population. The highest incident is in women age 20 to 44, but like I said before, most do not even get a diagnosis until age 30. There's an unknown genetic component. There has been some studies that are going on to see if there's a link between siblings, mothers, and specifically daughters, but there's no scientific verification for this yet. And the prevalence of fibromyalgia rises with age. So as you increase in age, there's an increased chance that you will develop fibromyalgia in relation to other comorbid diseases. So by age 80% of that age population will have fibromyalgia and chronic widespread pain. Causes and risk factors. The cause is unknown. There's no known cause at this moment for fibromyalgia. Some of the factors that physicians say contribute to fibromyalgia are traumatic events and triggers, physical and emotional response, disease presence, and certain illnesses. Fibromyalgia varies between individuals, so the syndrome can develop with absolutely no cause or trigger at all, or can be triggered by a stressful or traumatic event. The risk factors are your sex, most common in women, family history, that is not determined yet, but it is seen that it has been passed down, and then rheumatic disease presence. Diagnosing it. The main symptoms of fibromyalgia are fatigue and pain overlap with many other disorders. So it's very difficult for physicians to diagnose right away if you have fibromyalgia. So there are no diagnostic testings for fibromyalgia, but blood tests are used to rule out other diseases such as chronic fatigue, depression, IBS, hypothyroidism, and many more. A diagnosis can typically be made if the patient identifies widespread pain for more than 3 months with no other medical conditions, and they have to be present on both sides of the body. And as you can see in the diagram, there's a test for the 18-point tender point exam, and it's often given to patients to determine where their pain is being felt. So in order to be diagnosed with fibromyalgia, you have to feel that tender feeling of pain in 11 out of 18 spots. For treatment, there are medications available. Like I said before, there's no cure. So the individual has to find ways to manage the pain, improve function, and enhance quality of life, because there's no endpoint right now for this syndrome. There are injections, there's local anesthetics or cortisone shots that can be injected into the tender points that the physician determines. This can increase blood flow and reduce inflammation in associated areas if that's a problem area for the patient. The FDA has currently only approved 3 drugs to help pain management, and that's in addition to the over-the-counter aspirin or acetaminophen in very small doses. So the names that we would see on TV are Cymbalta, Lyrica, and Sebela. And due to symptoms of depression, some physicians will also prescribe low-dose antidepressants, because that is a very common symptom of fibromyalgia. So Lyrica, it's used to treat seizures, damaged nerve endings, and pain. Sebela, used to treat fibromyalgia and widespread pain throughout the body. And Cymbalta is used to treat depression and anxiety, as well as neuropathy. Treatment takes a team effort. It is best managed with the advice from a physician, guidance from a physical therapist, and most importantly, the self-care efforts from the patient. The goal is to reduce the pain, which in turn will improve sleep and relieves the majority of the associated symptoms with fibromyalgia. There are alternative therapies for pain management, and this can be physical therapy, osteopathic treatment, chiropractic care, water therapy, acupuncture, cognitive therapy, and massage therapy. And then in regards to self-care efforts, this is where the patient comes in. They have to be willing to do these things, and some of these examples are meditation, body scans, yoga, aerobics, water aerobics, deep breathing, purchasing appropriate pillows and bedding. This will help position the body in a correct way, massage tools, stretching, and daily exercise. That is key to reducing pain. The effect of fibromyalgia on exercise response. So patients who have chronic widespread pain have difficulty performing the exercises without wanting to stop due to discomfort. So because of this, they're not going to progress as quickly in our exercise programs as a non-fibromyalgia patient. The National Institute of Arthritis and Musculoskeletal and Skin Disease stated that fibromyalgia patients can have a 30 to 50% standard aerobic capacity, range of motion, and often decreased muscular strength due to inactivity from pain. So the medications that are used to manage fibromyalgia can also cause higher heart rate, high blood pressure, nausea, dizziness, blurred vision, and depression. So it's up to us as being healthcare professionals and fitness specialists to understand the heart rate and blood pressure before, after, and during exercise in order to keep our clients safe. There are many benefits of exercise in regards to fibromyalgia. Exercise is essential for maintaining the muscular strength, flexibility, controlling weight, and managing psychological disorder symptoms. The best exercises for fibromyalgia are light and moderate intensity exercises that are low impact. Just a few of the outstanding benefits from exercise for fibromyalgia are: it boosts the endorphins. This will reduce anxiety, stress, depression, and this will in turn help fight pain. It boosts the body's neurochemical balance and neurotransmitters. It slows down heart rate and balances adrenaline response. It improves quality of sleep, increases energy, reduces anxiety and depression, strengthens bones, strengthens muscles, and increases aerobic capacity. Fibromyalgia case study. So Barbara is a 48-year-old woman who was diagnosed with fibromyalgia in 2014. She has no family members with history of heart disease. She lives a very sedentary lifestyle and has been smoking for 10 years. Last week she started taking aerobics class and is enjoying it so far. She is 5'8", weighs 140 pounds, and this gives her a BMI of 21.3 kilograms. Her blood pressure is 146/90. Her fasting plasma glucose is 90 milligrams per deciliter. Her total cholesterol is 198. Her HDL is 65, and her LDL is 133 milligrams. She's recently diagnosed sevella, and Barbara is going to continue engaging in exercise and hopes to learn better ways to manage pain. So due to her risk stratification, she has no risk regarding age, no risk regarding family. She does have a positive risk factor because she smokes cigarettes. She lives a sedentary lifestyle and just recently started exercising, so that is another risk factor. Her blood pressure is very high. It's over 140/90, so that's a third risk factor. Her dyslipidemia, she has no risks for that. Her total cholesterol, LDL, and HDL levels are perfect, and she has no risk for prediabetes. For a negative risk factor, she has one risk because her HDL is over 60 milligrams, which is great. So regarding her risk factors, she has 2 total risk factors because she had 3 positive and then 1 negative. And her classification would be moderate because she is also asymptomatic. For her goals, she really wants to improve the aerobic capacity to decrease her blood pressure because right now it's a little too high, and she wants to develop a workout plan and quit smoking. For exercise testing, if she was going to do a submax test, a medical exam and supervision is not necessary, but for a maximal test, it is recommended that she get an exam and have supervision from a physician. Her exercise prescription focal points, she really needs to include resistance training, aerobic training, stretching, and gross motor activities to start her moving her body and really benefiting from the exercise prescription. For aerobic training, she will do 3 to 5 days per week, 45 to 60% VO2 max, 30 to 60 minutes a week, and this is water aerobics, walking, jogging. For resistance training, this is 2 to 3 days per week, 1 to 3 sets, and 8 to 12 reps. This is weight machines, free weights, body weight exercises. Balance training. Balance and flexibility is very important for her because she needs to start moving her joints. So both of these are 2 to 4 days per week at moderate intensity. And this is variations of yoga, static stretching, planks, Bosu ball exercises. And in conclusion, fibromyalgia is a chronic pain condition that has no cure yet. It has no definite cause, and scientists are working to develop a cure, but the phrase exercise is medicine is honestly the most appropriate quote for this syndrome. The benefits that this exercise prescription can give to someone with fibromyalgia is outstanding. So through the process of self-care, home remedies, medication, and exercise, the symptoms of fibromyalgia can ultimately be managed at a very comfortable level. And in the case of fibromyalgia, being self-aware and being an advocate for your own health is absolutely key to managing a cureless syndrome. And these are my sources. They are a combination of journal and online resources regarding fibromyalgia. Thank you. Have a great day.